But anyway, let's continue on now. Um, Eric Topol is really confused about the numbers, something fierce, and that is causing him to draw a lot of incorrect conclusions. But let's continue.
Right,
Yeah.
right. It's that whole point. If 100% of the people are vaccinated, then everybody's having, and anybody who's in the hospital, obviously that defined a breakthrough illness. So people are missing the point about denominators and fractions. But if you calculate the vaccine efficacy, as has been done in the UK and in Israel, effectiveness, I should say, it stays at the 90% level. It has never changed with Delta. So here, I think
No, it doesn't. I'm sorry. It dropped the whole year, and everybody remembers it. And by the way, if you don't believe me, just Google it. I mean, just put it in for a search on YouTube, because people have put together these hilarious montages of Peter Hotez and Anthony Fauci having to admit that the effectiveness is dropping every month, and you need a new booster and all this. And I mean, Peter Hotez said it's a two vaccine program, and that'll treat you, and everything will be fine. You'll be cured. And then, as the video progresses, he's up to 5 boosters after the initial 2 shots. And so he just really makes a fool out of himself, having to say that 5 boosters are needed right after he said that is all you need is 2 injections. More like 7.
is, again, whenever there's just a sleight of hand with statistics, it's being used in a way by anti-vaxxers in what I consider to be deliberate. A lot of these people are intelligent, they know better, but this feeds their narrative.
Yeah. There's another comparison here which should be pretty straightforward. I mean, we have something like 159 million people now who have been fully vaccinated in the U.S., right? And we have probably a similar number of people who have been exposed to the coronavirus. I mean, there's only 34 million confirmed cases, according to the CDC, but we know it's got to be higher than that. So we can compare, and we have, tens of millions of people in each cohort, people who've been vaccinated and people who've gotten COVID. Now, if the people who've gotten COVID, we have around 600,000 who have died. For the people who've gotten vaccinated, when we ask how many people have died as a result of getting vaccinated, and this is just a comparison of just how dangerous is COVID compared to the danger of getting vaccinated. These data are kind of hard to get your hands around, because it seems like there are reports of people dying after getting vaccinated without there being any real assessment of whether the vaccine was causally responsible for their death. I mean, these are just people who happen to drop dead from something after being vaccinated. And that the highest number I've seen there.
I'm going to get to that in a second, because that's very important. But the reason nobody knows, Sam, is because people on the government narrative side refused to allow autopsies of all these people. For the people who died from the vaccine and the people who died from atypical pneumonia from COVID. Autopsies were not allowed. And, this is something that was a breach of a statute, because when there's a death of unknown cause, it's not just the preference, but it's the law in almost all jurisdictions in the United States that an autopsy must be performed. And they were all but not. I mean, they were not allowed during COVID. And because they didn't want to know the truth. The government went in there and would not allow autopsies. And the other problem with your data is about the 600,000 number, is all you have to do is watch the videos that Dr. Ezike, who is the public health director of Illinois, that she put out, because she made a very clear statement that anyone who dies with a positive PCR test within 28 days of their death, it's considered a COVID death. And she said, it doesn't necessarily mean that they died of COVID, only that they had and she says only that they had COVID at the time of death. But of course, they didn't have COVID at the time of death. They just had a positive PCR test, which is a totally fraudulent way to determine if someone has COVID or not. You can't do it. You can't use PCR to make a diagnosis. And I can tell you why in 10 words. Is all PCR does is looks for a little genetic fragment in the nasopharynx of the person who's being tested. Remember those long Q-tips they stuck way up your nose? They're just looking for a little piece of genetic material in there. It doesn't mean you have the disease. You could have had the illness 3 months ago, and the piece of genetic material would still be in your nasopharynx. It doesn't have anything to do with being actively infected with a virus or anything like that. So the whole thing was deceptive. It was, what's the word I'm thinking of? It starts with an M. Well, deceptive is good enough. The PCR test did not determine who had the disease at all. It just determined who had a positive PCR test. And by the way, the WHO put out a primer for the PCR test, and I don't expect everyone in the public to understand how PCR tests work. But basically, a primer on the PCR test is what they're looking for in the nasopharynx. And they put a PCR primer out that they recommended people use that's found on the chromosome number 12 of humans. Think about that for a second. That means anybody who's a human is going to be positive. It's going to have a positive result. Think about that for a second. Boy, you sure got a lot of false positives from that one, didn't you? If it's from the human chromosome number 12. And how do we find that out? We did a blast search on that sequence. And it turns out it's on chromosome number 12, the human chromosome. So there was so much fraud going on, it's unbelievable. So let's continue with this talk because Sam is getting ready to say that there are 12,000 deaths due to the vaccine, but of course we all know about Denny Rancourt saying that there were 17 million deaths as of September of 2023. Now, let's stop for a second and think about that. Not 12,000, but 17 million worldwide. Now, I have not looked at his data. I have not looked at it. And I don't know whether it's accurate or not. But a lot of people have looked at it, and a few people have debated Denny Rancourt on this. He's a PhD physicist that sort of changed his focus over to statistical analyses of things. So I don't know how many people died of the COVID vaccine. But I can tell you that 600,000 and eventually 1 million did not die from COVID. There's so many problems with that, it's amazing. And again, we couldn't confirm it because they wouldn't allow autopsies. So let's continue, and I do have something else to say about the VAERS counts when we get to that. But Eric Topol is going to divide Sam's number by 1,000 just arbitrarily right here and say there were maybe 12 that died of the vaccine instead of 12,000. So let's listen in.
Error is 12,000.
Yeah, but that is it's probably 12.
Right. Yeah.
That's probably how many.
Yeah. I mean,
if it's that many. But
yeah,
I think this is the problem you're bringing up. Is this unfortunate situation? You know, we all like open science, open data. But the CDC, when they set up the VAERS, this is the adverse event reporting system.
Right.
They didn't recognize that this was going to be used by anti-vaxxers because these cases are not adjudicated. They've not, as you say, not been reviewed. They have no idea whether the death has any linkage, because we know, people, when you have 162 million Americans, which we have as of today, who are fully vaccinated, some people are going to die naturally with vaccination. And so these are people part of the VAERS reporting system. Now, what is extraordinary here is that this is used on a daily basis. The likes of, Fox News, Tucker Carlson, Laura Ingraham, mainstream television stations and lots of other entities are using this data, and it's obvious misuse, because unlike the clinical trials where no one died of a vaccination, the safety was, it was just extraordinary. No one died of the vaccine in either Moderna or Pfizer, when the 75,000 patient trials, because every case, every potential.
Wait a minute, Eric. You just said no one died that was vaccinated in the trials or died of the vaccine. How do you know that? I just told you about a large arm of the trial, and I know you know about this, where 21 people died in the vaccinated group and only 17 in the control group. So you're mixing up your data here very badly. Also, let me just say something about VAERS. VAERS is a very time-consuming thing to fill out when you report an illness. And my business partner's son, who is a 30-year-old, skinny Vietnamese guy, actually did not die, but 2 weeks after he took the second dose of the vaccine, his right arm went numb. He couldn't speak. He threw a middle cerebral artery embolus in there to block and give him a stroke. And he was in very bad shape. They did a dynamic CT, which I'm sure you're familiar with, and all of it, he had 5 vessels in his heart that were blocked by a showering of clots from his vaccine. And I remember he's a 31-year-old skinny Vietnamese guy. And remember here, he had a 5-vessel bypass by what everyone considered the best surgeon in the Palo Alto area. And when he woke up from it, he said a couple of words, and then he went to sleep and was unable to speak the next day, and he's in a wheelchair and he can't function at all. And I hate to use the word vegetable, but that's sort of the life he's leading now. And Henry, his name is, and here's a picture of him in his wheelchair. I hope you can see a little bit of it, but I dedicated the book to him, the first book I wrote. And I've spent a lot of time with him trying to teach him how to add and subtract small numbers and everything again, and read. And I did not even fill out the VAERS form for him. And I'm that close to his mother and him. And it's just an enormous undertaking. So if you think that VAERS is something that a bunch of anti-vaxxers use to run the numbers up, I think you're mistaken. As a matter of fact, it's just the opposite. Harvard Pilgrim Health did a study, and they determined that only 1% of adverse events are reported to VAERS. So you immediately divided Sam's number of 12,000 by 1,000 to get down to 12, where the Harvard Pilgrim Healthcare has actually done a study on this, and they say it's only 1% they say that only 1% gets reported. So you've got, they need to multiply Henry's number by 100, as opposed to divide it by, not Henry's number, Sam's number. According to them, they would multiply that 12,000 number by 100, which would give 1.2 million, instead of dividing it by 1,000. We don't know what the actual number is, but you can't just arbitrarily divide things by 1,000 and think it's valid. At least Harvard Pilgrim Healthcare did a study on it, and they determined that only 1%, meaning you have to multiply it by 100, only 1% is reported. Again, we don't know the real number. Excuse me, my burned phrenic nerve is giving me trouble. Let me continue.
Potential side effect is reviewed by an events committee. Now, we have one of the ways you could die of a vaccine would be if you had anaphylaxis, that you did just profound allergic reaction. But there's been multiple reports of the people who had anaphylaxis specifically with the mRNA vaccines, and they haven't died. I mean, they got treated, and a few, a small number had to get hospitalized. But that would be the one thing you could link with death. Now, there are these exceptionally rare side effects, like, with the J&J and AstraZeneca, this blood clotting issue, which is called vaccine-induced thrombocytopenic thrombosis, or what we have seen very rare myocarditis in young people, particularly men, with the mRNA vaccines. These are exceptionally rare. Guillain-Barré with, Johnson & Johnson, 100 cases among 12 million people vaccinated. So if you just look at these rare things, first of all, they don't die. Most of these people don't die. They recover. Myocarditis, almost all recover, and it's very mild. With the blood clotting issue, well, if it does occur where there's a cerebral sinus thrombosis, yes, that has a high fatality rate, but it's incredibly rare. One in hundreds of thousands of people with AstraZeneca or with J&J, not seen with mRNA. So just to review the composite here, the safety is overwhelming, but the VAERS open data registry of unadjudicated data is what's causing the problem, because it's being basically used by people who either don't know or unknowingly are using it to spread false information.
Right. Yeah. So I take all those points, and undoubtedly that's the correct way to look at it. But even if we took the VAERS numbers at face value, even if we acknowledge that 12,000 people have been killed outright by these vaccines, it still makes COVID look a hell of a lot more dangerous than the vaccine for COVID. Right. I mean, it's like you're still talking about when you have on the order of 160 million people who've been fully vaccinated, 12,000 people dying. I mean, that's less than 1 in 10,000 people dying based on this intervention. It would be a depressing number, but it's so much better than the number for getting COVID without having the benefit of the vaccine, that people still have this upside down, even taking those numbers at face value, which of course we can't do.
I couldn't agree with you more. In fact, you're looking at it overall. With respect to the exceptionally rare side effects that I've mentioned, the chance of you having any of those from COVID is considerably higher.
Yes.
Orders of magnitude higher. So yes, across the board, the relationship between getting COVID risk versus any risk of the vaccine, it is overwhelming that the vaccines are providing an exceptional net benefit, and that can't be questioned. That's real data. That's the most solid evidence data set that I've known in my 35 years in academics.
And it's important to realize that when you're talking about numbers this large, when you're talking about 160 million people being exposed to any intervention, there will always be some number of bad reactions that, if you focus on those without understanding the background statistics, could make a rational person, an otherwise rational person, nervous about that intervention. But I mean, the truth is, if we were giving people peanut butter as a prophylactic against COVID, if peanut butter were 100% effective against COVID, some number of people would die outright from peanut butter.
That's right.
I mean, that's the nature of human biology. But obviously, we would consider it an absolute gift beyond words if peanut butter could prevent this disease.
Well, one other thing I just want to mention, because what you're saying is so spot on, but the issue about the concerns of long-term effects of the vaccine, I do want to address that because a lot
Let's
of
do it.
people say, well, you know, I think the data look good, but what about could something happen later? You know,
Right.
and the answer there is, I think, pretty astounding in that in the history of vaccines, there has never been something that showed up beyond 2 months after the vaccines were in common use. Okay, we're now, you know, beyond 7 months. So there is no reason to think that these vaccines are going to be different than vaccines that have been going on for, you know, many decades and so many different diseases and platforms. So the long term, people should have confidence in vaccines because we're not going to. There's no more surprises. You know, the surprises have been unveiled either in the clinical trials or the first 2 months. When they get into, you know, you have 190 million Americans who've been exposed to at least one dose. We have hundreds of more millions around the world. We know what these vaccines do. There's no long-term surprises that we could see at this point.
Right. But
This is not true because these guys recorded this during the Delta variant, which is 7 or 8 months after the vaccines came out, I think. And of course, we're finding out now that there's IgG3 to IgG4 class switching, and IgG4 has a temporal association with cancer. And it doesn't, or the likelihood that that switch is going to occurs more and more with each booster that's given. So he's totally wrong about this because some people haven't even gotten their maximum number of boosters yet. So everything he's saying is just wrong.